This video is of a patient who has sustained a complete tear to her ACL. She's a young athletic female who, what we're looking at now through the arthroscope is the remaining portion of her ACL. You can see there's a large fragment. This is commonly seen with torn ACLs that is incarcerated on the tibial side of the knee joint. Now, the first step in ACL reconstruction is to clear the loose debris from the previously torn ACL. We resect or clean the portion of the old ACL off both the tibia and femur bone. Now in this next sequence, what we're watching is you're going to see a series of guide wires and drills that are forming a tunnel in both the tibia bone as well as the femur bone. In ACL reconstruction, we're unable to repair the ACL end to end. We actually have to drill tunnels in both the tibia bone as well as the femur bone to secure the new graft. Now here we are drilling a tunnel into the femur bone. Now the placement of these tunnels is very precise. We use a series of measurements and guide wires to ensure that the sockets or the holes that are drilled in the tibia and femur bone are placed in just the right position. And here you'll see that this is looking up into the femoral tunnel. This is nice and far back in the knee. Excellent position on both the femoral as well as the tibial tunnel. Now the next step in ACL reconstruction following drilling of the tunnels is passage of the graft. Now what you see coming to the screen here is what's called a femoral fixation device. This is basically a device that's going to go implant up inside of the femur bone, and it's going to hold that ACL graft in a nice position. Now this screw-like device that we're looking at now on the screen is something called a retro screw, and this is used to fix the ACL graft on the tibial side or on the lower side of the knee joint. And you'll see a sequence here shortly where the tibial fixation is in place, and there's a nice new reconstructed ACL ligament.